Hello, my name is Justin, and now I'm going to present about HIV and AIDS. What is HIV and AIDS? HIV stands for Human Immunodeficiency Virus. Inside your body, you have special cells that are called CD4 cells, or sometimes T cells. When your body has an infection, those special cells provide information to your body on how to fight the infection. HIV latches onto those T cells and copies itself, and then it destroys the T cells. So now your body can't fight infections as well. If your T cell levels drop really low, then it can become AIDS rather than HIV. And AIDS stands for Acquired Immune Deficiency Syndrome. So what are the symptoms? Many people that have HIV don't experience any symptoms, but you can. After your exposure, from 2 weeks up to 3 months, you can become very sick. You have a fever, chills, a rash, night sweats, fatigue, and many other symptoms. But many people do not have symptoms. If HIV later becomes AIDS, then there's a much higher likelihood of you having symptoms. And that's because when your body now has an infection, remember, it can't fight as well because of the cells that have been destroyed. So you can experience diarrhea, fever, vomiting. Some people will have different forms of cancer with AIDS. So HIV, you can have no symptoms, but AIDS you often will. So how do you get HIV? That virus itself is in bodily fluids, including blood, semen, breast milk, vaginal fluids, and anal mucus. To get HIV, you need to share bodily fluids with someone who is infected. So how do you transmit HIV with those fluids? First is, unprotected sex. Second would be if the mother has HIV and gives birth to her child or breastfeeds later, she can pass HIV to the child. The third is if you use drugs and share needles and don't clean them. Number 4 is maybe if you work in a hospital or you have some occupational exposure to infected fluids. And fifth, which is now pretty rare, before it was a little more common, if you had blood transfusion or an organ transplant, there was a likelihood that you could get HIV, but now they screen all the blood. So it's not common now to have that. It's pretty rare. And so how do you get AIDS? Remember before, those special cells, the T cells, once they drop in the amount that you have, then HIV will then become AIDS. Or there are special types of cancer that are common to AIDS, or some opportunistic infections of special kinds that pretty much signifies that you have gotten AIDS. So what's the treatment for HIV and AIDS? There isn't a cure yet. There is some medicine, referred to as antiretroviral treatment, or ART. There's special medicines that you must take every day that will stop the virus from copying itself. It doesn't eliminate the amount of virus you already have or cure you, but it does decrease your ability to transmit the virus to other people, and for it to slow down how the virus can copy itself in your body. AIDS it also does not have a cure, and treatment depends on what different infections you may have. The medicines are varied if you have a type of cancer from AIDS, or, you know, remember those opportunistic infections, that special type of infection, maybe they have antibiotics for that, or, but there's many different types of treatment, but unfortunately not a cure. So how do you prevent HIV? First, very important is to get tested for HIV. You can have a blood test, or they have an oral swab that you run around your gums to collect cells, and they put it in this container and do this special test that takes 20 minutes, and you can see if you have the HIV virus. One other way to prevent it with sex is to use a condom or a dental dam when you have sex. If you use drugs, don't share your needles. Or if you must share needles, then remember to clean them. And if you work in a hospital area or exposed to different fluids, remember to wear gloves and be careful that you limit your exposure. If you're pregnant and you have HIV, discuss with your doctor how maybe you can prevent HIV from transmitting to your baby. And thank you for watching this movie. I hope you learned something about HIV and that you keep yourself informed and that you